Good morning to those of you on the West Coast, and good afternoon to those of you on the East Coast. This is David Spain, the current president of AAST, starting off our first webinar with our associate members, so welcome. We're going to give people just another couple minutes to log in here, and then we'll get started in just a couple minutes. We'll go over the ground rules before we get started. And then once we get rolling here, we'll show you guys how to ask questions and communicate while this is going on. All right, Sharon, are you ready to get started?
I am, thank you.
All right, okay. Well, as I said, good morning or good afternoon, depending on which part of the country you're in. I think we got about 20 people signed up here, which is pretty good considering it's the middle of the day and you're all busy surgeons. We're going to talk this morning about how to get involved in the AAST. I'm not going to talk super long. Now, just for everybody on the line, you can, on the control panel, there's a way you can raise your hand, and then down below there's a section that says questions. You can type a question in there, and then as we go along, I'll either answer them as we go along if they're pertinent to the section we're on, or we may go over them at the end and address them. And so just again, if you want to raise your hand, just click the little hand icon there and I'll be able to see it, and then write a question down below. All right, so good morning, good afternoon. This is the first of a series of seminars and for our new associate members. And let me just start off by saying this is probably one of the most innovative, creative, and exciting things that AAST's probably done in 20 years. The whole idea of starting an associate member category really came out of our strategic retreat a couple years ago, and we really thought it was important to get young surgeons involved in our organization. We think this is a great organization. We think it's vibrant. We think it has a lot to offer. We think that interest in acute care surgery and surgical critical care fellowships over the last couple of years has just been increasing every year. And there's a lot of enthusiasm out there, and I think that we need to make sure that you guys get an opportunity to get involved in the organization and participate. And so our goal with this associate membership group really is to get you involved in the organization. This is going to be meaningless if you pay your $35, you put a line on your CV, and then you don't do anything. We really want to get you involved and get you contributing to the organization. And so we're going to start off today going over some ways that you can do that. So I was going to be pleased if we had about 30 or 40 associate members join. We had 109. I was ecstatic. I couldn't believe we had this many applicants in our first year as a brand new initiative. So there's 28 residents, 41 fellows, and 40 junior faculty. And again, the whole goal of this is to get people involved and get you aligned to become full members of this organization when the time is right. So you will be getting new member packets. They should be mailed this week, and there'll be a lot of information in there. Those of you who you will be getting your pins, which are really nice, and we ask that you wear, if you're going to the clinical congress, we want you to wear your associate member pin. If you're going to any local meetings, you'll wear it around the hospital. I mean, I think you should wear it as much as you want. And hopefully people will ask you about it, and you can explain to them that you are an associate member of the AAST. talk a little bit about what are the benefits. You know, honestly, I think it's the AAST is the premier trauma organization in the world. I think our European counterparts definitely are growing and improving, but clearly we've been around the longest and are really the lead organization in the entire world as it relates to trauma and acute care surgery. And our collaboration and cooperation with our international colleagues is only increasing, but you now are members of the premier trauma organization in the entire world. For those of you who are junior faculty, there is CME available online at no charge. There's over 100 courses in there. For the trainees, these courses are available to you as well. You obviously don't need the CME, but you will be able to go online and go through these courses. They're fantastic content, easy to digest at your own schedule, with a lot of useful stuff, especially for a trainee. Really, really great content there. You will also be able to participate in the virtual grand rounds. These are nationwide webcasts of grand rounds. They happen the third week of every month. And you can see here's a link. I'll show you and I've done one of these in the past, and here's the schedule. So you can see they have virtual grand rounds. They're I think, about 5 o'clock West Coast time on Wednesday afternoon. So you can see the ones coming up this year, Bob Baracco, Sasha Adams, Ronnie Rosenthal are going to be talking about geriatric surgery verification. In November, we're going to have a general surgery topic, intercutaneous and interatmospheric fistulas, with Rick Miller and Dr. Stassen, who moderates that. And then in December, they're going to be talking about transfusions and disaster medicine with Dan Grabo and Jay Doucette. So there's a whole variety of these topics. They're excellent opportunities to see what's going on in the AAST. Another benefit is you also get a discounted annual meeting fee, so you'll be able to attend the meeting as a member and get a discounted fee. And then finally, there's also an option to survey members. So if any of you want to do a survey that requires a membership of the AAST, you can, hold on, go back. You can go on this web page and you can submit a survey. You can see here there's a new AAST survey policy, and there's a form here that you submit, and it goes for approval to make sure it's a worthwhile, worthwhile survey. We don't want to put our members at survey fatigue, but if you have a good idea that would be worthwhile, then you can send it through here. The AAST will send it out under their email, and so it does come to people as an official AAST sponsored email survey. You can also see this is also the member page here. There will be a section added here for, oh no, here it is, associate members. So you guys have your own landing space here on the new members page. And as we develop more activities and contents and webinars, they'll be listed here under the associate members. You see all the past newsletters are listed here. You can get to the membership directory if you do want to find a member of the AAST, including other associate members. You can go to the directory, type in a name, and you'll automatically get their email and mailing address. And over here on the right-hand side, you can see there's a list of upcoming meetings that may be of interest to people, such as the Detroit Symposium and the Pan American. Another benefit is like I say, is the opportunity to get involved or even develop multi-institutional studies. This has been a big emphasis of the AAST over the last couple of years. Most of what we're able to do, obviously, large prospective randomized trials are expensive, but there are ways to do some observational trials, some short-term intervention trials that are maybe low cost that you can do through the MITC. And if you get involved in those, you can develop your own. You can participate in an ongoing study, but that's another opportunity to get involved in the organization. You will all be asked to join committees. I think so far already 45 or 46 of you have volunteered for committees, and we've made assignments. All of you will be getting the request in that packet, and you'll be able to get involved with different committees and contribute. Obviously, as new members, you'll be able to network. I mean, you will be meeting division chiefs, trauma director, local and national trauma leaders in the AAST. I think most of you have already had an opportunity at our meeting already to meet some of the leadership in the AAST. So this is going to be a huge opportunity for the residents and fellows. The ability to network and start talking to people when you're looking at your first jobs is going to be huge for the junior faculty. The opportunity to meet people and collaborators at other institutions is a huge benefit. So you'll be able to do this, all through your membership here. You'll also have the option to purchase a subscription to the AAST, to the journal, for $98 a year. And also you can volunteer to become a reviewer for our open access journal, the Trauma and Acute Care Surgery Open. So for more information, that'll come in your packet. So a couple of questions here, which I think I'll answer as we go. Dr. Coleman asked, can we clarify what exactly is a multi-institutional study? And this is, this might be on the next slide here. Let's see. We'll get to that. So the multi-institutional trial, again, if it's something where you want to get, 4 or 5 or more, 10, 15 trauma centers together to do a study, you can go on the website. Well, I'll show you here in a few minutes, but you can go on the website and solicit other interested parties and try to sign up other studies. I mean, most of what's been done currently are either retrospective studies, where you might get 10 or 15 trauma centers together to look at their last 5-year experience with blunt aortic injury. And there's been a handful of short-term observational studies where you might do a 3-month observational study of a particular topic. You will be, another question is, when do we receive our packets? Those are coming out this week, I believe. Sharon, is that correct?
Yes, there'll be emails coming out with the committee assignment and what the committee duties are. Mm-hmm.
Yeah. So as I said, a number of you have already been volunteered and assigned committees. So 46 have already been assigned to committees. You will be getting that email request and information packet in the next few days. And there's still plenty of time to add people to committees. We don't have any hard deadlines. So if you didn't get it in right away, don't panic. We can still put you on a committee and get you involved. Most of the committees sort of have some organizational meetings in and around the Congress, so they really haven't ramped up their activities. So if you're just now getting assigned to a committee, you haven't missed anything crucial. Again, if you do get put on a committee, what's going to be your responsibility? Most of these committees will be holding monthly conference calls, so we ask that you try to participate in as many of those conference calls as possible. All these committees will have projects and work that needs to get done, and you can volunteer to do that. The AAST, like a lot of professional organizations, has a strong memory. So if you volunteer to do something and you deliver, we remember that. If you volunteer to do something and you don't deliver, we remember that. So if you're going to volunteer, make sure it's something that you're interested in and you have the time to do it, and then follow through with it. You can also suggest new ideas and projects. You're going to be involved in committees and stuff, and most of you are going to be more proximate to what's happening than a lot of the older folks like myself. And so there may be problems and issues on the ground that we're not even aware of. So having fellows, residents, junior faculty on these committees is going to give us a whole new perspective that may lead to all sorts of new projects. So again, don't be bashful if you're on these committees. And then again, if you are coming to the meeting in 2020, then you will be invited to come to all the committees meet, usually early in the morning before the meeting starts. Not quite so bad in Hawaii, but you will get an invitation to attend the prevention committee meeting or the disaster committee meeting, or whichever one you're assigned to. So if you're at the meeting in Hawaii, you will be able to attend those meetings and contribute. And if you haven't volunteered, there's still time to do it. And actually, on the control panel, if you look, there's a tab called handouts, and if you open that up, there's actually the volunteer form is on the in the handout. Can I just see if this will open it up for us? But again, if you open it up on that under the handouts, there's a list there for the. Now my computer's being slow, so we'll go back here. But here it is. So here's the volunteer form. So again, no, don't worry if you haven't gotten this back yet. It says, October 9th, but there's still plenty of time to get members involved. Let's see. All right. So, Dr. Coleman sent me a note earlier, asked about the MITC. So, this is a large group. I said most of what they're doing is, some retrospective studies where you go to the trauma registry of, 10 or 15 centers and get a large experience with a particular diagnosis or a condition. But you can also propose a new prospective observational study, and you can go on the website here, and then this is how you initiate a new study. And so this is the MITC page. And again, if you want to initiate a new study, you got to, ideally it's prospective. You have a clear and relevant hypothesis. You got a good design. It's feasible, not complex, time consuming, or extremely costly would be the other thing. And then obviously a study period less than 2 hours. And again, you have some leadership potential, and you have leadership potential in coordinating a center. So you can come on here, and there's you submit the form, and it goes to the MITC. You submit the application form, goes to the MITC, and they will evaluate it and approve it or not. And then you can see there's a data collection tool that AAST uses, or you can do all your data collection online. So it's a huge opportunity and benefit to do this. Oops, hold on, my computer is jumping here. Hold on one second, sorry. So again, the committee will review your study, provide some feedback where necessary, and then they'll approve studies again that I think are worthwhile. And then it gets posted on the website, and interested centers can sign up. And you'll have a questionnaire to make sure they meet your entry criteria, and it gets posted on the website. And if approved, then you can also use the data collection tool of the AAST for no fee. It's kind of like a red cap, similar as to like a red cap tool, but we'll use it through the AAST to collect all your data. And again, there's also a number of studies currently ongoing. So there's about 20 of them right now. Some of them are in various stages, but again, if there's any of these that your center is not involved in that you want to get involved in, you can volunteer through the MITC page of current ongoing studies. So you can see here, multi-center validation of trauma-specific frailty index in geriatric patients, pregnancy in EGS, the Meridians, the ongoing study of open abdomen in EGS. We're participating in that one. Some validation studies for some of the scoring tools that we have. Here's another prospective observational study, pre-hospital tourniquet use. So again, these are the ones that are currently going on. There may be an opportunity to participate in them, but you could also develop your own project and elicit trauma centers to participate. Also on that page, there's funding opportunities listed. So if you're looking for funding, whether it's from the DoD or the NIH or other venues, these are also listed on the research page, and they're updated every quarterly. So again, if you have any questions about the multi-institutional trial, your contact in the AAST is Jamaica Smith. She is the liaison for the MITC. And again, if you email her and have any questions, she'll be able to help you. So again, the other thing we want to do is, as I said, I don't want the associate membership to just be some line on your CV and an annual dues you pay. We really want this to be meaningful. So one of the things that, and this was largely Sharon and her staff came up with this idea that we really need to form an associate member council. So your group's going to have its own leadership structure, and you're going to develop that. So we have a draft. We're going to highlight some areas we think you should work on, and we'll have a future webinar probably in January to discuss some structure and committees and some policies. But I really want this to be something that you as a group help develop. And the goal will be to have your charter done by next September, and your group will approve it, and then it'll go to the board of managers at the meeting in September to approve. And so by this time next year, you're going to have a formal structure. There's going to be some leaders. There's going to be some associate member council specific committees that will be your own. And you may decide to have a senior member on there as an advisor, but you may also decide to have your own independent committees. So we really want this to be driven by the associate members and really organized by you, and you'll have the opportunity to pick your own leaders and to advance in that organization. And those people will be communicating with the board of managers and the AAST as a whole. So I think it's going to be another opportunity for people to get involved and demonstrate leadership and commitment to the organization. So we have one major action item for today. So we need a couple volunteers, at least 3 or 4, but it could be more. I told you we have virtual grand rounds, but we actually want to have a specific set of virtual grand rounds for the associate members. And so these could be clinical topics, they could be leadership topics, they could be a webinar about how you want to organize yourselves and chart your path. It's up to you. But we need probably at least 3 or 4 people to volunteer to help coordinate this. As I said, I think we ought to propose to have 2 or 3 topics, suggest some dates, like when you'd want to have them, what kind of presenters and moderators you have. And then once you design that, we got to get the paperwork in to the AAST office at least 6 weeks ahead of time so we can get everything organized. So Dr. Stassen coordinates the virtual grand rounds we now have through the education committee. So she'll help coordinate this and get it all set up and approve everybody. And we'll have to get all that paperwork into Rachel Sass at the AAST. But again, this would be an opportunity to have 2 to 3 virtual grand rounds, again, specific for the associate member category. Like I said, if you look now, most of the virtual grand rounds are clinical topics, which are very pertinent for you as a group, but you may decide you want to have some of the sort of soft skill topics, right? Leadership and mentorship and how to get involved. So you may have a whole different, agenda and need that isn't currently being met by our virtual grand round. So again, this would be very specific for you as a group. So we need 3 or 4 people to volunteer. You can email Rachel or the both of us, and we can start to get those coordinated. Probably kick those off after the first of the year, just in terms of trying to get things organized. So again, to review, this is the AAST leadership. Yes.
David, can I just jump in? Julia Coleman said she's willing to help. And then Jason Miner had a question that just said, these volunteers are help pick topics or to volunteer to give a presentation or both? And it's both.
Yes. Yes.
Both. So, feel free if you want to volunteer to help set up the grand rounds. If you also have a topic you want to present on, I think it's anything they want to do.
Yes. Yes. So again, we definitely need 3 or 4 people to organize the seminar. But if you actually want to volunteer a particular topic or to speak, or you have thoughts about who would be a good speaker for a topic, definitely send those in to Rachel and myself. All right, let's see. Now, so this is the AAST staff. So Sharon's our executive director, and her contact information that you see there. And most of the stuff she deals with are the board of managers and the journals, and a couple of committees. Jamika is also another senior manager and head of operations and member services. So she does a lot of the membership stuff, scholarship, and Rachel does a lot of the education stuff. Most of who you'll be dealing with is Bria Sanders. So Bria's program coordinator. It's going to be the administrator in charge of the associate council. And you see her contact information there. And Bria manages all our social media. So, anything you guys want to do, I think we're talking about developing a specific social media page for the associate members, and do we have a specific Instagram or Twitter account for our associate members? I think all those things are open for discussion, and Bria would be the contact person to help you with those. All right. And let's see, next. So, again, this was for any of you who have questions. There's a little hand here. I think some of you already asked a few questions. So again, if you have any burning questions, you can click on the little hand here and post a question for us. And then we're probably going to have another webinar. We're thinking in January, probably the third or fourth week of the month. I think the East meeting is like the second week in January, around the 14th to the 16th. And so we'll probably have our second webinar sometime after that. As I said, an opportunity for you as a group to set up a virtual grand rounds of your own. And I think probably, just in terms of getting coordinated and organized, probably January or February is a reasonable timeline. I think that was all the comments I had, right? Correct, Sharon?
Nope, that's it. I don't really see any other questions right now.
So it's free for all time. Again, the key thing for this is, I think that it's a huge, opportunity for you as a group to get involved. I think that I'm just old enough. When I was joining the AAST, it was a closed membership. There was only 350 active members, and you had to wait for somebody to turn 65 or to die before they could let another person in. And it was very exclusive, and it's just a 180-degree change now. It's a very open membership. We want to get people involved. We want to get people interested and engaged. And I think that, this associate member council is something that would have never been even imaginable, in this organization 20 years ago. And I think there's a real enthusiasm in the leadership, as I said, to have this, not just be the, like I say, the last thing we want is for you guys to be sitting at the kids' table at Thanksgiving dinner. That is not the plan for this. The plan for this is to get you engaged, get you involved, and have you contributing to the organization. And this is good for us, because this is going to energize us. It's going to let us, recognize and find people who are engaged and contributing. So,
Dr. Singh,
yes.
Can you unmute all the participants, because Dr. Goulet has a question, Nicole Goulet.
Now I got to figure out how do I do that, Sharon?
At the bottom of the attendees, where it says all in red or all in green. At the attendees.
Muted.
Unmute all. Okay, I think I just did that. Let's try it.
Hi, this is Nicole Goulet.
Perfect.
Hi. I just had a question. Now we have an opportunity to be unmuted and kind of speak with each other. But is there going to be, besides these webinars and the grand rounds, an opportunity for us to have like a conference call amongst ourselves where we kind of start talking about the charter and how to organize ourselves and other things like social media and kind of brainstorming together?
I don't see why not, right? Like Sharon, like there's no reason why you guys couldn't have a webinar like this where you could all get online and as a group, you know, and start to talk about those things. I think that would be a good idea, right? And you know, we can probably get a copy of the draft charter out to you guys and let you have a session where you sit down and look at it as a group. I think that would be a great idea.
Yeah, maybe after it all comes out, I don't know if Sharon, maybe we could just pick a date, like kind of like this, where something gets sent out and it's just kind of the associate members talking.
So, Sharon, did I mute you? All right. Well, I might have muted Sharon somehow or another. Anyways, I don't see any reason why not. So I think that would be a good idea. All right. Any other questions from?
Sorry,
one
I'm
more.
unmuted now. This is Sharon one last time. I just wanted to talk, respond to Dr. Goulet. So yes, the document I sent is still in draft. We're finalizing it. Once we present the document and I do some more research on some other charters, exactly what you said, we'll present it in one of these webinars, and then we will be asking for volunteers to help, or we can set up these webinars for you guys to discuss at a group and to discuss how you want the charter, what you want the charter to look like. So that will be a series of probably conference calls between January and August.
Yeah. Yeah, well, maybe we could get it out and let you guys, you know, the earlier you get going, the better. So if we could get, you know, maybe after the clinical congress, we might be able to get the charter out to you group. And you guys, again, if you want to organize a conference call or a webinar, you know, sometime in November or early December, I think that'd be fine.
I'm sorry, Nicole Goulet here again. One other thing, just with the clinical congress coming up and also East, I don't know if there's an opportunity for us to have kind of each other's contact so we can maybe organize even a get together at one of those meetings for whoever's present.
Again, perfect idea. Like, you know, so Sharon, do we have a, like, we should start an associate member mailing list, right? And, you know, I think, again, somebody wants to, you know, post an idea to have a get together, a little social thing at the clinical congress or at East. I think that'd be a good idea.
Sure. So we do have the listing of all associate members, and I can send that out to everybody. But we have a room on clinical congress. AAST does. I mean, it's being used extensively for committee meetings on Monday and Tuesday, but it's open all day Wednesday. I could always have something in that room, or we can, you know, send out an email to everybody to find out who is going to be attending clinical congress, and then we can make a plan. We got 2 weeks, so that's fine.
Yeah. All right. Okay. Any other questions? Let's see. Yeah, okay, so a couple other people, yeah, Ashley said she'd be interested in meeting up at the clinical congress. I think that's a, you know, I'd say a good opportunity. A lot of our, so some of our residents that have joined and fellows should be up there as well. And I think it'd be good, again, good opportunity to meet everybody. You know, those of you who have been to the meeting and talked, you know, Mike Rotundo and I met at a residence lunch at the AAST in Philadelphia in 1991. And all these years later, we're still friends and still keep in touch. So, you know, the sooner you make contacts with your future colleagues and future leaders in surgery and trauma, the better it's going to be. The more, you know, again, the more personal it is, the more you know these people you're talking to on the phone and engaging with, and as associate members, the more, you know, the more important it's going to be, right? The more you know who you're talking to, and you can put a face with a name. It's just not some voice on the other end of the phone. So, good idea. Yeah, so Tanya asked if you'd have access to the membership section. Yes. We'll see. Sharon, they should be able to like pull up the full membership list, correct?
Yes, they will. When the packets go out, we're still turning them all over in the system. So they will have it probably within what, the next 2 days? In here, a couple days, maybe by the end of this week, early next week, they will have access to it.
Yeah, it is helpful to find. Okay, so that's coming. Yeah, it is helpful to find people, get email address, make contacts with anybody in the membership. All right. Any other questions? Let's see. I think we've addressed all the ones that are typed here. Does anybody else have any questions they want to ask? Going once. All right. Well, again, I think we had pretty good turnout. I was worried middle of the day that it would be a lot of participation here, but we actually got 30 of you on here. I'm gonna call out Dr. Kazi. Dr. Kazi, where are you?
Hi, can you hear me?
Yes.
I'm in Ethiopia.
I thought so, yes. Dr. Kazi is one of our one who got fellow last year. She's an awesome fellow, and she's now doing a Fogarty Fellowship and is working in Ethiopia. So I had a feeling you were calling from a distance. So
Yeah.
all right. Well, good. All right. So anybody else? Any last minute questions? All right. Well, again, first of all, I'm thrilled we had 109 members. I'm really surprised we had 30 of you on the line in the middle of the day here. A bunch of busy surgeons. So I appreciate everybody making time to come on the webinar today. And like I say, this really do want you guys to get involved. I think that if this associate member council is going to be a success, we need to provide all of you with an opportunity to have meaningful engagement with the organization and to really feel like you are a full member of this group and somebody whose contributions that we value. And that's the goal. That's the experience we want it to be for you as a group. And hopefully this is something that's so worthwhile. You're just going to continue in this organization and become full members, once you're out and out of practice. For those of you who are the junior members, that there are a couple requirements to join. You have to have attended a meeting, and you have to be a fellow of the American College of Surgeons. So it's going to takes 2 years to become a fellow. So it's a couple years after, once you get out of training before you could even be qualified to become a full member. But our goal is that all you associate members would be so engaged in contributing that when it became time for you to become full members, this would just be a pretty straightforward decision. It's not a guarantee, but we hope that we get you engaged and give you meaningful work, that it's going to be an easy thing to just have you become a full member in our organization. All right. Well, unless anybody's got some last minute questions, we can finish a few minutes early, let everyone get to lunch, and we will get the draft charter out to you guys maybe after the clinical congress sometime. I think a conference call or a webinar to let you guys look at it and start discussing it. I think the sooner the better, give you time to really work on it. That's the goal of having it done next year. Now, like I said, our one action item is to have people volunteer to help with the virtual grand rounds. We got a few people typed in here that they were willing to help. And anybody else, if you have any thoughts about topics, speakers, or want to help get involved in the organizational end, just let either me or Bria know. All right. Unless there's last minute questions, we can end a few minutes early and we'll get working on scheduling the next webinar. All right. Thanks, everybody.
Thank you.